Cleaning agents. The agents for cleaning automated washer such as ultrasonic washer, washer disinfector and automated cart washers. Chemical method include enzymatic solution, detergent, soap which is antimicrobial or plain soap. Therefore, it is important to understand the workflow of Central Sterile Supply Department CSSD. So let's study Central Sterile Supply Department CSSD. CSSD is an integrated place in hospitals that performs sterilization of medical devices, equipments, consumables that are used in operating theaters of the hospitals and also for other antiseptic procedures. The processing area of CSSD consists of 4 unidirectional zones starting from an unsterile area to sterile separated by physical barrier. Decontamination area, packaging area, sterilization area, sterile storage area. Decontamination area. The items are collected and then decontaminated or cleaned by either manual wash or by automated machines like ultrasonic washer and washer disinfector. Packaging area. Here the items like medical devices are enclosed in material or a container designed to allow the penetration and removal of sterilant during sterilization and then to protect the device from contamination and other damage following the sterilization and until the time of use. In the decontamination area, we collect the items and then clean by manual washing or by automated machine using ultrasonic. Then in the packaging area, the medical devices are enclosed in material or container designed to allow penetration and removal of sterilant during sterilization and then to protect the device. So then we add the sterilant and then remove it and protect the device until the time of use. Then the sterilization area. The packed devices received from the packaging area are subjected to sterilization process by steam sterilizer, ethylene oxide sterilizer or plasma sterilizer. Sterile storage area. After sterilization, the sterilized items are stored in this area. It has an issue counter to supply the items to operation theater and various other areas of the hospital. Factors influencing the efficiency of sterilant or disinfectant. The efficiency of a sterilant or disinfectant is affected by various factors. Organism load. As an bioburden increases, the contact time of the disinfectant also needed to be increased. Central Sterile Service Department. So this is how CSSD looks. This is the issue counter. Then this is the storage area, packaging area, decontamination area, recipient counter and sterilization. So first is organism load, then second is the nature of organism. Organisms vary greatly in their resistance to disinfectants and sterilants. The decreasing order of resistance of microorganisms to various agents used for sterilization or disinfection is as follows. Prions have the greatest tendency to cause resistance to disinfectant, then bacterial spores, then coccidian oocytes, then mycobacteria, then non-enveloped viruses, then fungi, vegetative bacteria and enveloped viruses. Concentration. The agent should be used at their optimal concentration to produce the desired antimicrobial action. Higher concentration may corrode the material and lower concentration may be less effective. Contact time. It is the most crucial factor for the disinfectant to be effective. It refers to the time period a disinfectant is in direct contact with the surface or the item to be disinfected. For surface disinfection, this period is framed by application of the surface until complete drying has occurred. Lower exposure time doesn't achieve effective killing. Now, temperature. The activity of most agent increases as the temperature increases. However, inappropriately higher temperature may degrade the agent. Stability. Some agents are stable at in-use concentration, for example hypochlorite, and should be freshly prepared each day. Local pH. The pH influences the antimicrobial activity. An increase in the pH improves the antimicrobial activity of some disinfectants like glutaraldehyde, quaternary ammonium compounds or QAC, but decreases the antimicrobial activity of others, for example phenol, hypochlorite and iodine. Relative humidity. It is an important factor influencing the activity of gaseous disinfectant such as ethylene and ethylene oxide. Then organic matter such as pus, serum, stool and blood can interfere with the antimicrobial activity of some disinfectants, for example hypochlorite and quaternary ammonium compounds. This can be overcome by mechanically cleaning the instrument or surface or floor before it is subjected for disinfection or sterilization, and by increase in the exposure time or concentration of the agent. However, few other disinfectants such as phenolics or glutaraldehyde retain their efficiency in the presence of organic matter. Biofilm. Formation of biofilm is another mechanism which prevents the entry of disinfectant and sterilant to act on the microorganisms which are embedded inside the film. Property of an ideal sterilant or disinfectant. An ideal disinfectant or sterilant should have various properties: broader microbial activity, fast acting, not affected by environmental factors such as organic matter, non-toxic, compatible with surface and materials to which it is used, odorless or pleasant odor, economical and environmental friendly. Splouding's classification of medical devices. Earle H. Splouding in 1917 devised a rational approach to classify the medical devices into three categories to the degree of risk for infection involved in the use of items. Splouding classification of medical devices. Risk category definition, recommendation method and medical equipment or surfaces. First is critical device, which is high risk category. Items that enter a normal sterile site. Recommended method: sterilization, medical equipment or surfaces, surgical instruments, implants, prostheses, rigid endoscope, syringes and needles. Semi-critical device, intermediate risk. items in contact with mucous membrane or body fluids, disinfectants. High-level disinfectants can be used. Medical equipments are respiratory equipment, non-invasive, flexible endoscope, bedpans, urine bottles. Non-critical low-risk category includes items in contact with intact skin. Here, intermediate or low-level disinfectant methods are recommended. Non-critical patient items and non-critical environmental surfaces are the medical equipments. Now, this classification is used to categorize medical devices according to their intended use and subsequent level of processing required to render the device safe for reuse. Splouding classification scheme is so clear and logical that it has been retained, refined, and successfully used by infection control professions in planning methods for disinfection or sterilization. Various agents used in hospital for achieving sterilization and disinfection and cleaning are enlisted in the table 23.2 and are discussed below. Sterilants. Steam sterilizer, autoclave. Note that autoclave is an important question in the university exams. So what is the principle of steam sterilizer? Steam sterilizer functions similar to the pressure cooker and follows the general laws of gas. Water boils when its vapor pressure equals to that of the surrounding atmosphere. When the atmospheric pressure is raised, the boiling temperature is also raised. At normal pressure, water boils at 100 degrees Celsius, but when the pressure inside a closed vessel increases, the temperature at which water boils also increases. Mechanism of action. Most heat destroys microorganisms by irreversible coagulation, denaturation of enzymes, and structural proteins. Component of steam sterilizer or autoclave. Steam sterilizer is a pressure chamber. It consists of cylindrical, a lid, and an electrical heater. Pressure chamber. It consists of a large cylinder, vertical or horizontal, made up of gunmetal or stainless steel, in which the materials to be sterile are placed. A steam jacket, which is a water compartment, and a lid. It bears a discharge tape for the passage of air and steam. A pressure gauge sets the pressure at a particular level. A safety valve to remove the excess of steam, and an electrical heater. It is attached to the jacket that heats the water to produce steam. So this is the figure of autoclave, which has safety valve, discharge tape, pressure gauge, pressure chamber, steam jacket, electrical heater, and a lid. Procedure. The material to be sterile are placed inside the cylinder. The steam jacket is filled with the sufficient water. Lid is closed and electrical heater is put on. The sterilization process can be divided into 3 phases. Conditioning phase. After the water boils, the air in the chamber is completely displaced by the steam produced. The steam pressure increases inside when it reaches the valve. When it reaches the desired set level 15 pounds per square inch, the safety valves open and excess steam escapes out. Exposure phase. The holding period is counted from this point of time, which is about 15 minutes in most cases. Exhaust phase. After holding period, the electrical heater is switched off and steam sterilizer is allowed to cool till it reaches the atmospheric pressure. These phases are important, so I am reading it again. Conditioning phase. After the water boils, the air in the chamber is completely displaced by the steam produced. The steam pressure rises inside when it reaches the desired set level of 15 pounds per square inch. The safety valve opens and the excess of steam escapes out. Exposure phase. The holding period is counted from the point of time, which is about 15 minutes in most cases. Exhaust phase. After the holding period, the electrical heater is switched off and steam sterilizer is allowed to cool till it reaches the atmospheric pressure. Sterilization conditions. Steam sterilizer can be set to provide higher temperatures by adjusting the pressure provided to the vessel. Cycle duration varies 3 to 18 minutes depending upon the sterilization temperature of 121 degrees Celsius to 135 degrees Celsius. The most commonly used sterilization condition is 121 degrees Celsius for 15 minutes at pressure of 15 pounds IBLs per square inch psi. Uses of steam sterilizer autoclave. Steam sterilizer is most commonly used sterilization method in the hospital. It is used for all critical and semi-critical items that are heated and moisture resistant, surgical instruments, anesthetic equipments, dental instruments, implants, medical devices, surgical traps, and linens. Culture media preparations, medical waste treatment for waste and salts. Precautions. It should not be used for sterilizing waterproof materials such as oil, grease, or dry material such as glove powder. The chamber should not be overfilled and the material should not touch the sides or top of the chamber. Separate the steam sterilizers should be used for treatment of biomedical wastes. Precautions. As steam sterilizer works on the principle of boiling water, so waterproof material cannot be sterilized. The chamber should not be overfilled with the material, should not touch the sides and top, otherwise the chamber itself would be contaminated, and separate steam sterilizer should be used for treatment of biomedical wastes. Type of steam sterilizers. Steam sterilizers are available in various sizes and dimensions. Horizontal type, large volume capacity, figure 23.2a. So this is the figure of horizontal sterilizer, B figure. It is used in CSSDs, large size laboratories, and for biomedical waste treatment. Vertical type, small volume capacity, figure 23.2c. This is the vertical type. It is used for small size laboratories. Advantages. Steam sterilizer has the following advantages. It is low cost than ethylene oxide and plasma sterilizers. Sterilization cycles are fast compared to ethylene oxide sterilizers. It is non-toxic and leaves no byproduct behind, unlike the ETO. Now disadvantages. Disadvantages of steam sterilizer includes heat can damage acrylics and styrene PVC materials and corrode some metals. High temperature for prolonged time can harm or shorten the life of instruments. Moisture also adversely affect electronics and can cloud the sensitive materials or leave watermark stains on them. Sterilization control. The effectiveness of the sterilization achieved by steam sterilization can be monitored by biological indicators. This is oftenly asked in MCQ that spores of Geobacillus stereothermophilus are the best indicators. The spores are killed in 12 minutes at 121 degrees Celsius. Then we can consider that sterilization process is effective. Chemical indicators include external package control, for example autoclave tape, Bovidic test, and internal package control. Then physical indicators, for example digital displays on pressure equipment displaying the temperature, time and pressure.